Are you aware of this team of frontliners who work silently and calmly behind the scene, but their effects and their roles cannot be overemphasized? They are the engine behind the survival of critically ill patients or a person on the path of death. This team are known as the anesthesiologists, and I'm proud to be one of them. We are not just sleep doctors, we are lifesavers, we are resuscitation experts, we are intensive care unit physicians. We don't just work in the operating room, we are also found on the field during mass casualty or disaster management. We work in the intensive care unit and in pain clinic. Today, October 16, is World Anesthesia Day, and the theme for this year is Anesthesiology in Health Emergencies. Examples of emergencies handled by these frontliners include obstetric emergencies, in which we could have eclampsia, where a pregnant woman convulses following high blood pressure, or antepartum or postpartum hemorrhage, where there is massive bleeding secondary to some risk factors. We also handle patients that have cardiac arrest, meaning that a person suddenly becomes unresponsive and the heart stops functioning. We also have trauma secondary to road traffic accidents, or when there is mass casualty or disaster in an environment, etc. So what exactly do we do in the operating room? We induce patients for anesthesia, meaning that we put them to sleep or make them calm for the procedure that is ahead of them. We ensure they are pain-free, and most importantly, monitor their vital signs, which includes the blood pressure, the pulse rate, and the saturation of oxygen, and much more during the procedure and after the procedure. In accident and emergency, we take lead roles in cardiopulmonary resuscitation and advanced trauma life support. We give emergency drugs that jackback the heart. In worst case scenario, we take over the airway by intubating such a patient, meaning that we insert a tube from the mouth down to the lungs for oxygen delivery, because every second counts. In the intensive care unit, we decide the type of patient to be admitted there. We intubate them, connect them to mechanical ventilator, and set the parameters on these ventilators. We are like gatekeepers or guardian angel to this set of people while they struggle for their life. We also have procedural expertise in setting lines on major arteries and veins, which we call central line cannulation or arterial line cannulation. On the field, we assist the emergency team in triaging patients during mass casualties or disaster, and we attend to the critically ill ones. As pain experts, we manage both acute and chronic pain, and we are the team behind the epidural analgesia or working epidural for our pregnant women while in labor, reducing pain during this process. In conclusion, anesthesiology is a life-saving specialty during emergencies, and behind every successful rescue or surgery, an anesthesiologist is involved. On a lighter note, my name still remains Dr. Olajumoke Faruwa. I want to seize this opportunity to appreciate my teachers, my friends, colleagues in the anesthesia community, the World Federation Society of Anesthesiologists, for always being there when needed. Once again, I wish us all a happy World Anesthesia Day. Thank you.